Botox in the jawline. Does this cause further sagging of skin? I have some mild sagging around the jawline area and nasolabial folds. My doctor recommended that I think about having Botox to reduce the masseter muscles in my jawline. My worry is that if I have the Botox to shape the jawline, won't this mean that there is less support for the skin above it and therefore cause more sagging in the lower face itself? Not sure if I've explained it very well, but hope it makes sense.
Thank you for your question. You stated in your question, which you didn't submit with the photo, that you have some mild sagging along your jawline and that your doctor suggested doing Botox injections in the masseter muscle, and you're asking if that would cause more sagging, and you're not sure about whether or not to proceed. Well, I can certainly assist you with this question, even with the absence of a photo. A little bit of background: I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. My practice focus, amongst several areas, includes facial aging, including facelifting, eyelid rejuvenation, and non-surgical solutions for facial aging. And I can certainly give you an opinion from my experience with using Botox, which I've been using for patients since the early 90s, and I've been in practice in Manhattan and Long Island for over 20 years. So to understand the concept of how to improve a jawline that is sagging, there is certainly a legitimate question here as to the value of using Botox to relax or to reduce the masseter muscle. The masseter muscle is a strong muscle that is an important muscle for chewing. And in certain people where they have thickened masseter muscles, where they find the bulge of the muscle to be undesirable, there is a role for Botox to reduce the volume of that muscle, and of course without affecting the functionality of the muscle. So when you ask about sagging, I think that there may be some misinterpretation, and there are some methods of using Botox which can slightly improve the appearance of a sagging jawline. To share with you our approach and our practice that is non-surgical, which is clearly what you're interested in because you're asking about Botox, I would actually say that there is a valuable role of the masseter muscle, and as well as other muscular structures along the jawline. There is a procedure we perform in our practice called the Y-lift. And the Y-lift is based on this concept of using filler, such as Juvederm, Ultra Plus, and Voluma, in a very specific and elegant way that works under the muscles. And it allows the restoration of volume. You know, when you think about sagging, and I've written about this in a book that I did for consumers years ago, where understanding aging, there is volume loss and then there's sagging. And so when you describe sagging at the jawline, if it's very little, then there's a good chance that most of your issue has to do with volume. So in contrast to a surgery like a facelift, where we lift the skin and soft tissue and muscle to more hug the solid structure of the face, with Y-lift what we're doing is we're placing volume on the structure of the face so that it is referred to as structural volumizing. For a reason, going along the cheekbones, the jawline, you not only get better definition, your whole face looks younger. Now we can also do limited areas such as the jawline or just the cheeks alone. But the point is that I think if you're looking for an injectable solution for the jowling, I think that it's worth considering this type of procedure as opposed to using Botox for the masseter, which I don't think would be of that much value. It might be your doctor feels that the continuity of your jaw may be improved by reducing the volume and maybe making the jaw look straighter, but I think it's an indirect method, and I don't think it's going to generate the type of result you're looking for. So I would recommend you learn more about the Y-lift and consider this option, and just think about two ideas. There's volume loss and there's sagging. So with a certain level of sagging, you can't put enough filler. So that's certainly an important distinction. There are times where surgery is the only solution to get the kind of result you want. But I think that it's worthwhile considering, if you only have a slight bit of sagging, this technique called the Y-lift. So I hope that was helpful. I wish you the best of luck, and thank you for your question.